Imagine a health crisis silently growing year after year, affecting millions of lives and costing billions of dollars. Yet it rarely makes headlines. This is the reality of allergic disease in Australia, a condition that has quietly risen to become one of the nation's most expensive and pervasive health challenges. According to a recent report by Deloitte Access Economics, commissioned by the Australasian Society of Clinical Immunology and Allergy, ASIA, and the National Allergy Council, NAC, allergies are reshaping the landscape of public health in profound ways. But here's where it gets alarming. Since 2007, the prevalence of allergic disease has doubled, now impacting 1 in 3 Australians. The financial toll? A staggering $18.9 billion annually. And that's just the tip of the iceberg. The report, titled Costly Reactions, The Economic and Social Cost of Allergic Disease in Australia, paints a detailed picture of the far-reaching consequences of this health burden. Beyond the financial losses, there's an additional $44.6 billion lost annually in well-being, a figure that underscores the emotional, psychological, and social toll on individuals and families. For many, living with an allergic condition isn't just about managing symptoms. It's about navigating a life filled with constant vigilance, fear, and disruption. Allergies don't just disrupt health, they reshape lives, said Maria Said AM, co-chair of the NAC and CEO of Allergy Anaphylaxis Australia, AAA. Millions of families are living with constant vigilance and fear. What's driving this surge in allergic disease? The answers are complex and multifaceted. Experts like pediatric allergist Professor Kirsten Perrett, director of the National Allergy Center of Excellence, NACE, and leader of the Murdoch Children's Research Institute, MCRI, Population Allergy Group, point to environmental changes such as urbanization and air pollution, modern lifestyle factors like over-sanitization, and even increased awareness as potential contributors. Consider this. Australia has some of the highest allergy rates globally, including the world's highest reported rate of infant food allergies, affecting 1 in 10 babies. The implications are staggering, not only for the individuals directly affected, but also for their families and society as a whole. In 2024 alone, an estimated 16.4 million cases of allergic conditions were recorded among 8.2 million Australians. These conditions range from hay fever, affecting 24% of the population, to food allergies, 7%, and drug allergies, 5%. Many households manage multiple allergic conditions simultaneously, adding layers of complexity to daily life. The most common allergic conditions include allergic rhinitis, atopic dermatitis, asthma, food allergies, and drug allergies, which collectively account for 92.9% of all allergic disease cases. Interestingly, the prevalence of these conditions varies by age, gender, and geography. For instance, food allergies and eczema are more prevalent in young children, while allergic rhinitis and drug allergies tend to affect adults more frequently. The financial breakdown of these conditions reveals just how costly they are. Allergic rhinitis tops the list with 6.4 million cases costing $112.7 million, followed by asthma with 2.5 million cases costing $858.3 million. Food allergies, affecting 1.9 million people, incur costs of $42.5 million, while drug allergies impact 1.4 million people at a cost of $17.2 million. Other conditions like allergic chronic rhinosinusitis, insect and tick allergies, and atopic dermatitis contribute significantly to the overall burden. Together, these costs highlight the immense strain on individuals, families, healthcare systems, and the broader economy. But the story doesn't end with financial figures. The non-financial costs, measured in terms of lost well-being, are equally staggering. In 2024, these costs were estimated at $44.6 billion, reflecting the profound impact of allergic disease on quality of life. Productivity losses, which include increased absences from work and reduced efficiency while working, accounted for $15.1 billion, or 80% of the total financial burden. This reflects the demographics of those affected, with 68.9% of individuals being of working age, 15 to 64 years. Efficiency losses and direct health system costs made up the remainder of the financial impact. The report also sheds light on the specific areas of the healthcare system bearing the brunt of allergic disease. Public hospital admissions cost $98.3 million, while emergency department visits added another $145 million. General practitioner consultations accounted for $384.6 million, pathology services $8.5 million, and PBS prescriptions $501.6 million. Over-the-counter medications and immunotherapy further contributed to the total health system costs of $1.2 billion. So, what can be done to address this growing crisis? The report emphasizes the importance of a coordinated national response, highlighting several key priorities. These include enhancing clinical care and public health programs to reduce the economic and societal costs of allergic disease, supporting and upskilling healthcare professionals to enable earlier intervention, and improving data quality and availability. Additionally, further research into prevention and management strategies is crucial. Perhaps most importantly, allergic disease must be recognized as a chronic health condition, warranting the same level of attention and resources as other long-term illnesses. Australia's efforts in this area are led by two peak bodies established in 2022 following a bipartisan parliamentary inquiry and the release of the Walking the Allergy Tightrope report. The strength of this work lies in collaboration, said Dr. Michael O'Sullivan, ASIA president and clinical immunology allergy specialist. While progress has been made, he stressed that more work is needed to ensure Australians have access to high-quality, research-driven allergy care both now and in the future. This raises an important question. Are we doing enough to tackle this growing health burden? Should allergic disease receive more funding and attention from policymakers and healthcare providers? The answers may vary, but one thing is clear. This issue affects us all, whether directly or indirectly. If you or someone you know lives with an allergic condition, how has it impacted your life? Share your thoughts in the comments below. We'd love to hear your perspective.